Today, we're diving into a really important topic, health literacy. We're going to break down Professor Don Nutbeam's amazing work on how we take this big idea from just a theory into something we can actually use in the real world. I mean, who hasn't, right? We've all been there. And that exact feeling of being confused, well, it's at the very heart of a huge challenge in healthcare. And it's what we're tackling today.
You see, for a long time, the way we looked at this problem was honestly pretty one-sided, and that created a massive barrier for a lot of people. The old way of thinking put all the responsibility on the individual. If you didn't understand what the doctor was saying, that was seen as your problem to fix. But thankfully, that perspective is really starting to change.
So what's the new approach? Well, it's a much more effective model that sees health literacy not as just a personal skill, but as an outcome of the whole situation. Okay, this slide right here is absolutely key because it totally reframes the entire issue. Think of it like a bridge. On one side, you've got an individual's personal skills and what they know. But on the other side, you have the demands of the healthcare system itself, how complicated it is. Professor Nutbeam's model shows that true health literacy is that bridge connecting them. It's not just about one side. It's a shared responsibility to both build up personal skills and work to make the system less confusing. So the big question is, how do we actually do that? This is where we get practical and move from the theory to a real blueprint for action. And this model gives us that exact roadmap. You can almost see how it creates this continuous loop. It starts with developing a person's abilities. You see the brain and heart there for knowledge and motivation, and then it flows into two core strategies for intervention, which we're going to break down right now. All right, strategy number 1 is all about empowering people. And listen, this is so much more than just handing out pamphlets. This is about building real skills and genuine confidence, like knowing how to find trustworthy information online or how to make sense of medical stats. The goal is to shift away from just passive instruction to interactive learning that helps people feel like they're in the driver's seat with their own health. Now for the other side of that bridge, simplifying the system itself. This is where healthcare providers really have to step up. It means training staff to communicate clearly without all the jargon. It means designing websites and clinic forms that are actually easy to get through. And it definitely means taking an active role in fighting all the dangerous misinformation we see everywhere. So the crucial point here is that this has to be a system-wide effort. It's about building what's called a health literate organization, where everyone, from leadership right down to the frontline workforce, is on the same page working to make health information accessible for everyone. And all of this brings us to the single most important takeaway from this entire framework. Professor Nutbeam's call to action is so simple and so powerful. The models are there, the evidence exists, the challenge now is just to do it. Ultimately, this isn't a one-way street. Improving health literacy is a true partnership between people who feel informed and a healthcare system that is supportive and easy to understand. It's a goal that really benefits every single one of us. And it leaves us with a critical question to think about. What's one practical change we could make right now to simplify healthcare for everyone?